Project 2025 and the plans to ban abortion and erase LGBTQ people. Hello, I am Kevin Knaus, an independent health insurance agent in California, and I like to stay abreast of potential changes that might be coming down the road relative to health insurance and coverage benefits so I can alert my clients. One of those potential changes is the mandate for leadership, the conservative promise known as Project 2025. And this very large, wide-ranging volume is meant to be a playbook in the circumstances that if a conservative president wins the presidency, then they can start implementing changes within the federal bureaucracy immediately on day one. Now, this Project 2025 has 30 chapters, 880 pages, and there were multiple conservative contributors to writing the overall playbook, as some people are calling it. Now, I am focusing today on Chapter 14. That is the chapter on the U.S. Department of Health and Human Services, written by Roger Serevino, who was an attorney at HHS in the Civil Rights Division between 2017 and 2021. So he's familiar with the operations of HHS, and he knows how to change things because this is a huge bureaucracy. Now, his chapter 14, the emphasis really is banning abortion on many different levels and erasing LGBTQ people, gender identity, sexual orientation from any consideration within the federal government. And he throws several pot shots at Anthony Fauci over the COVID response, the masks, and the vaccines. But let's look at Department of Health and Human Services. Their mission statement is to enhance the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. Again, emphasizing all Americans. Now, Department of Health and Human Services is a huge bureaucracy. Underneath that department, that large umbrella, you have the Centers for Disease Control and Prevention, Centers for Medicare and Medicaid Services, the Food and Drug Administration, Indian Health Services, National Institutes of Health, the Affordable Care Act, and healthcare.gov, and the division that Serevino worked in, which is the Office of Civil Rights. So you say, Kevin, he wants to ban, abortion and all this. So how can you point to that? Well, one of the things I did is I looked at the terms that came up the most within that chapter. Abortion is he refers to it 142 times within the text, including endnotes. COVID, 46, marriage, 29, pregnancy 14, aborted 10, gender identity 10, and so you can see the declining number of references to some of the other issues, health insurance, contraceptives, and virus. Now, that's all kind of social and cultural stuff for the most part. Health and Human Services is looking at trying to prevent diseases, get people healthy, keep them healthy, sustainable, and productive. So when we look at the terms that you would think someone might focus on at the Health and Human Services to meet the mission of helping all Americans, alcohol, 1 reference, asthma, 0, beer, cancer, 1, fentanyl, 1, 0 on guns, nothing about heart attacks, liquor, 1 reference to opioids and tobacco. And those are things that are plaguing our communities that need the attention of local, state, and federal government. But to illustrate Serevino's bias and focus on banning abortion and erasing LGBTQ people, I'm just going to read some of the quotes from the text that he wrote. Now, when it comes to making any policy decisions, you need data. And that's one of the first things that he is going after. The Centers for Disease Control and Prevention, abortion surveillance, and maternity mortality reporting systems are woefully inadequate. CDC abortion data are reported by states on a voluntary basis. And California, Maryland, New Hampshire do not submit abortion data at all. So it bothers him that he doesn't have a clear picture of who is getting an abortion and the number of abortions that are happening. And then he goes on to state, because liberal states have now become sanctuaries for abortion tourism, HHS should use every available tool, including the cutting of funds, to ensure that every state reports exactly how many abortions take place within its borders, at what gestational stage of the child, for what reason, the mother's state of residence, and by what method. Now, it's just really offensive that this guy thinks that women are just, I'm going to go to California, go to Disneyland, and then get an abortion. No, people are coming to California and other states because their home state has banned or severely restricted abortion options. It's not tourism, it's a matter of life, their health care choice. Abortion pills, the FDA should reverse its approval of chemical abortion drugs because the politicized approval process was illegal from the start. Now that the Supreme Court has acknowledged that the Constitution contains no right to an abortion, the FDA is ethically and legally obliged to revisit and withdraw its initial approval. So he wants the abortion pills, banned. And if he can't do that, he talks about making sure that they can't be sent in the mail, across state lines. So he's really looking at all the different angles to restrict abortion as much as possible. But why? Why does he have this fanaticism over abortion? As he states, providing funding for abortions increases the number of abortions and violates the conscious and religious freedom rights of Americans who object to subsidizing the taking of life. I think it's a novel legal concept that if you hurt somebody's feelings, that is an injury that somehow should be corrected. And if that was a real legal premise, then our free speech rights would be curtailed, because every time someone opens their mouth, they offend, they hurt somebody's conscience because of what they say. So, but that's where this gentleman is coming from. And he knows how HHS works. He knows the levers. And so now he brings out the big sledgehammer, the Medicaid threat, which is huge, and states get a lot of money from Medicaid. So he thinks withdraw Medicaid funds for states that require abortion insurance or that discriminate in violation of the Weldon Amendment. The Weldon Amendment declares that no HHS funding may go to a state or local government that discriminates against pro-life health entities or insurers. In blatant violation of this law, 7 states require abortion coverage in private health insurance plans, and HHS continues to fund those states. Now, whether the funds that HHS is providing are somehow subsidizing abortion, I don't know. In California, the health plans must cover elective abortions within certain rules. But that's the big threat, is that they would take away Medicare funding for millions of Californians and people on Medicare, just because California thinks it's okay to have abortion-related services covered by health insurance. Now, regarding LGBTQ people, the author, unfortunately, family policies and programs under President Biden's HHS are fraught with agenda items focusing on LGBTQ plus equity, subsidizing single motherhood, decentivizing work, and penalizing marriage. These policies should be repealed and replaced by policies that support the formation of stable, married, nuclear families. Well, health insurance goes to creating the formation of stable married nuclear families. But that's not his thing. This author, Serevino, he just really doesn't like anything to do with gays, gender identity. It's just really, it really seeps through. It's infused in the whole chapter. And he kind of even just admits it in one section: woke policies. NIH, National Institute of Health, became so focused on the Me Too movement that it refused to sponsor scientific conferences unless there were a certain number of women panelists, which violates federal civil rights law against sex discrimination. NIH has been at the forefront of pushing junk gender science. Okay. So this whole Me Too movement, I mean, that's kind of a flag that, you know, he has a bias against women, and that actually is borne out in some of the other things he writes. He believes that deadbeat dads should be able to claim the child tax credit even though they're not taking the children as dependents. But he doesn't have a mechanism for getting that child tax credit to the actual children, of which the deadbeat dad is not paying child support. But, you know, he's offended somehow that mothers may have a higher stature when it comes to, you know, providing for children. He wants to bring back discrimination. The HHS policy, discrimination on the basis of sex, includes but is not limited to discrimination on the basis of sex stereotypes, sex characteristics, including intersex traits, pregnancy or related conditions, sexual orientation, and gender identity. In other words, the department proposes to interpret Section 1557 as if it created special privileges for new classes of people defined in ways that are highly illogical and unscientific. Well, they are scientific. Now, Section 1557 is the non-discrimination rule, and I have to take training on this. Now, before Trump was president, you know, we could not discriminate on the basis of sex stereotypes and, you know, gender identity. Now, Trump gets in, that's pulled. Now Trump is out, Biden comes back in, and they reinstate that. And it's just simple. If someone comes to you and you think, or maybe you do know, that they're transgender, you can't discriminate on the basis of that, and you shouldn't. But he wants to allow people to discriminate. And some of the ways you do this, if you understand bureaucracy and the rules, you can pull the trigger on that to begin erasing people, at least discriminating against them. Now, is this guy really kind of, you know, over the edge on some of this stuff? And this one area just really shocked me. And he's talking about the formation of families and, you know, supporting families. And sometimes, you know, there's problems with families. And he talks about allocate funding for promoting father involvement. Okay. Parents who do not make a sincere or serious effort should have their parental rights swiftly terminated and put children in foster care. That's the state just ripping children away from their biological parents based on what premise? Because you don't pay enough attention to them at dinner time? What is the criteria for ripping? But that's what this guy is about. If your lifestyle, the way you raise your children, doesn't fit into his narrow fundamentalist view of the world, you know, take the kids away. Of course, he wants to eliminate Head Start. At the very least, the program's COVID-19 vaccine and mask requirements should be rescinded. You know, again, he is one of those individuals that felt very offended that he had to wear a mask. And he even talks about in the vaccines that people should be able to get vaccines that were not developed from cell lines that may be tied to an aborted fetus. I mean, he's getting really, really narrow on the clinical stuff and the scientific stuff. But he also says that HHS shouldn't be prescribing things and acting like a doctor. But of course, he's acting like your pastor. Evil Anthony Fauci, he's got a get a dig in on him. Unaccountable bureaucrats like Anthony Fauci should never again have such broad, unchecked power to issue health guidelines that will certainly be the basis for federal and state mandates. You know, some of these people still harbor ill will because they had to wear a mask and they had to stand 6 feet apart. It's really, it's depressing because they're just not living in the real world. There's a lot more. I will post chapter 14 on the Health and Human Services written by Roger Serevino on my website. But essentially, the focus is to ban abortion at all costs. We don't care about cancer. We don't care about alcoholism. We don't care about guns or any of that. It's banning abortion and getting LGBTQ people out of recognition, acknowledgement from the federal government. Well, if you have any comments, questions, or suggestions, you may leave them down below in the comment section and I may reply to them. Otherwise, for Ensure Me Kevin, I'm Kevin Knaus.